recommend getting them in September, October. But there, even if you haven't gotten one yet, it's still a good time to get them.
Certainly. Is there any kind of forecast for the cold, flu, and COVID season this fall?
Not specifically for this year, but going back to previous years, we do typically see a peak for starting with COVID, I guess. We see an initial peak in late August, early September, usually coinciding with kids going back to school and increases in those populations generally. And then we usually see maybe a second peak of COVID, depending on the strains that are circulating, around the holidays and around New Year's. And then for influenza also, we typically see it start to increase as the weather gets colder. Currently, influenza levels are low. COVID levels did go up around the time that school started, but have come back down since the middle of September. But we anticipate that it will likely go up again as the weather continues to cool and people get together for family gatherings during the holidays and things like that. So it's definitely a good time to get your vaccinations if you haven't already.
And that's a very good point. It's these viruses flare up this time of year because we are spending more time indoors together with bigger groups of people in confined spaces. And, once we speak, exhale, sneeze, anything, those little droplets, can be transmitted very easily.
Yep, that is correct. And, generally, these viruses and other respiratory diseases are spread, as you mentioned, through inhalation of droplets and aerosols from people who are sick. Also, though, as we know, they can land on surfaces if people aren't covering their coughs and washing their hands and things, and others could potentially touch those surfaces and then touch their mouth or nose or eyes and become infected in that manner as well. So, but that's not as common as getting it through inhalation of respiratory aerosols or droplets, as you mentioned.
What's the difference between this year's flu vaccine compared to last year's?
A few different strains that each year they try to tailor the components to contain a number of different strains that they see circulating in other parts of the world. To create the flu vaccine in time for flu season, they have to kind of use data from other parts of the world where it's circulating in the southern hemisphere, for example, before it comes here. So those are, best guesses as to which strains might be included each year. And there are a few differences between this year's and last year's, depending based on the strains that were circulating in the winter time in the southern hemisphere before it reaches the United States.
Could you explain for us, please, exactly how the flu and COVID vaccines work to protect the body?
Yeah, generally, they expose the body to either, inactivated virus or portions. In the case of the COVID vaccine, it's the directions that your body can then make or use to make a portion of the COVID vaccine, the spike protein that's on the outer surface of the COVID vaccine. And what that does is then the body develops antibodies towards the inactivated vaccine or the spike protein in the case of the COVID vaccine. And then those antibodies then allow you to more quickly and effectively respond to an infection if you should get one.
For those of us
Or
planning
prevent it in the first place.
Oh, I'm sorry. I stepped on you there. Go ahead. Could you repeat what you just said?
Well, yeah, I'm sorry. I was just saying it can, reduce, your chances of both getting ill, or if you do get ill, it will reduce your symptoms in most cases. So.
Thank you very much. My apologies. For those of us planning to get the flu and the COVID vaccines, maybe we want to get that over with in one visit. Can you do that?
Sure. Yep, that is definitely allowed. For some folks, if they have strong reactions to, the COVID vaccine in terms of not adverse effects, but, it does challenge your immune system and makes you feel a little run down. You could consider getting them staggered, but it is certainly, within the recommendations to get them at the same time if you would like.
Mm-hmm. I think you've answered this question already, but when is the best time to get vaccinated?
I would say early to mid-fall is the best time to get vaccinated to provide good coverage for the cooler months, and then also to be able to extend that protection through early spring when we still have many times high levels of various respiratory viruses circulating.
Yeah, exactly. How long does your protection last?
It varies by vaccine, but in general, for the flu vaccine, you do have good protection for about 6 months or so, and there's even protection after that. It's just it does start to wane, and I'd say similarly for the COVID vaccine. And that also is dependent on which strains are circulating. For in some years, the components of the flu vaccine have been very good matches to the circulating flu strains that are going around. But then sometimes new strains pop up, later in the season that may not have been included in the vaccine. But regardless, they will still provide some protection. But it does depend a bit on which strains are circulating. And with COVID, it's similar in that the vaccines were developed against the currently circulating strain, which has been pretty consistent for a while now. But there's always the possibility that another strain come along that is different enough to where the vaccine effectiveness might wane a little bit more quickly. But typically, they do provide very good protection for 6 months and even longer.
What happens if a person misses the ideal vaccination window?
That's fine. I mean, you might be at some increased risk early on. Like I said, currently COVID and influenza levels are low, so there's still a really good time to get vaccinated before we start to see those levels of infection go up in the coming months as we anticipate.
Most of us get our flu shots in the fall, and don't really think about it again for another year. Don't some people get shots a little bit more frequently, especially for COVID? How long is it safe to wait to get your next shot after you've had your last one?
Well, yeah, currently we would just recommend one, per year. But there are some cases, as you mentioned, for folks who are immunocompromised. They, in consultation with their physicians, may want to get another shot 3 or 6 months after their first shot. But for the average person, an annual shot is considered sufficient. But if you are immunocompromised because you have, say you're undergoing cancer treatments, or you have HIV, for example, or any other steroidal treatment sometimes can reduce immune ability. So if you're immunocompromised, you should certainly consider a second dose at some point, but that should be determined in consultation with your healthcare provider.
We're talking to Ryan Wozniak. He's a supervisor with the Wisconsin Department of Health Services Bureau of Communicable Diseases. We need to take a break right here, but we will be right back. You're listening to Community Comment on 95.3 WBEV, powered by Daily Dodge.
As the leaves